I want to ask you about the cases, Colm, because I was looking back at some of the news stories in the front pages of the newspapers actually on this very day last year, and it's sort of mad when you compare the front pages from last year to this year, because it nearly seems like we've kind of made very little progress, in the sense that we've effectively been in level 5 since the 26th, since Stephen's Day. Everybody's kind of cocooning, they're staying within their 5 kilometres, and despite the rollout of the vaccination programme, we're still touching with 600 odd cases yesterday, and the R number rising again. Are we making any progress?
Yes, if we look at the numbers, and we've become addicted to numbers over the past year, it is very despondent. It would be it would create great despondency to look at the numbers now. Yes, the 14-day is stuck at 159. It's not moving. It's moving up, if anything. The 5-day moving average, that's the average number of cases per day, is 574. And we know they'll still convert to hospitalisation. Some of those people will get seriously ill and even require ITU. And that has happened with monotonous regularity right through this experience of the pandemic. But we're not back to square one. And I'll tell you why we're not back to square one. Because we have now more or less completed vaccination in residence and long-term care settings. We are now well into 195,000 vaccinations in the over 70 age group, and we've more or less completed the frontline healthcare workers. This means if the worst effects of the virus, we know 90% of deaths are in the over 70 age group. When we complete the over 70s, and we're well halfway through that at 250,000, we'll have got to the end of this week, we will have afforded great protection to the most vulnerable section of the population. So I would urge people not to give up hope. There's huge hope with the vaccine. There's real evidence, not just from the trials that all the doctors are talking about, but from real life experience in Scotland, England, Israel and anywhere, that we're seeing huge drops in hospitalisation, big drops in death, including frailer people and older people. And in our own country, I could just give you 2 examples, Andrea, with healthcare workers. In the week ending January the 17th, we were looking at, in acute hospitals alone, 1,000 healthcare workers a week being positive with the COVID. In the recent weeks, it's dropped to 14. And that's because we vaccinated them, not just community transmission falling. And similarly, what we call healthcare associated COVID, meaning how people who catch COVID in hospital, that's fallen from about 500 per week in mid-January to about 40, 45 now.
Okay, but despite the fact that those that have been vaccinated, that there isn't a further spread effectively, that it is working for those that have received the vaccine, we were only chatting to people here in Lunchtime Live at the start of the week who, delighted with news that they could go in to see loved ones that they didn't get to see in nursing homes, maybe since December and January, haven't seen their family, their parents and stuff in months. And yet, they're still kind of calling for this idea of a vaccine, a passport or some sort of a vaccine cert, that it nearly seems, Colm, like despite you get the vaccine, there's nothing you can do. You can't go anywhere. You can't do anything.
The tough messages, and it's not coming from me, so don't shoot them out, but it's coming from World Health experts. Dr. Fauci, who spoke at a web link to the RCPI the other night, the WHO lead for Europe, is there is a kind of magical thinking evolving that the vaccines will replace public health measures immediately. That's not the case. They enhance public health measures. We're going to have to, the first purpose of any vaccine programme is to protect the people I talk about, those with underlying illness and older people. And there's real evidence that's happening. The second purpose we all want to get to is where it gives this herd immunity. If enough of us take up the vaccine, where it can begin to replace some of the public health measures. But it's too early in view of the experts in the WHO and elsewhere to say that we can do that.
What about the R number? Because you talked about that community transmission, and like people know all about this R number now, but it's somewhere between 1 and 1.3 we heard at the NEFIT briefing last night. Are you worried about the impact that could have now on HSE services?
Well, let's look what the R number means and translate into human terms. It's a cumulative total of millions of small actions, interactions, or actions and interactions that didn't take place. And it's a report card, if you like, on all or multiple interactions. It tells us how much we're contacting each other and how transmissible, how much this virus is spreading. At 1 to 1.3, that's telling you that there's too much interaction happening, and frankly, and that there's interaction taking place at a pace that allows the virus to transmit and grow. It's not just a question of that. We know the variant that's predominant in this country now, this famous B117 variant that came over in December, that's about 90% of cases we're seeing now. It certainly is more transmissible. So we already knew we were dealing with a virus that was transmissible and hopped easily from one person to another. Now we're dealing with its more angry cousin that's able to do that with greater ease.
I want to ask you about an issue that was raised here actually with Kieran and the hard shoulder here on News Talk in recent days, Colm, and it's about the vaccinators. And so these are people who are putting their hand up and they're saying, I've worked in healthcare settings with the HSE, or I have a medical background at some point, and I'm willing and I'm able to go out and help with the rollout of the vaccine. And they've been on the show with Kieran talking about the fact they've been asked to jump through hoops, providing birth certs and marriage certs and anything and everything that would seem utterly irrelevant to being somebody putting your hand up to go and do the vaccines. So what's the story there? Like, do we need vaccinators? Do we have enough? Do we want more?
We do. And first of all, we have. If you look at, it's not one single. We have a team, if you like, a broad team of vaccinators, but there's different elements of the team work for different settings. For those over 70s, for example, it's the GP team of vaccinators, and they were the best crack team for this over 70s because they do it year in, year out with the flu vaccine, and they know these people, they know where they live, they know how to contact them, they know how to advocate for the vaccine and so on. In the residential care settings, we use our school vaccination teams because of their mobility and their awareness of bringing vaccines and the transport requirements of vaccine and so on. But as we move, what Kieran is probably referring to is the mass vaccination centres of 38 or 7 or 8 planned, 13 opened, which we'd be manning with newly recruited vaccinating teams in addition to our core vaccinator teams that exist. And certainly we want to make that application. This question has been raised, especially from people who are retired, people who are proven registered healthcare practitioners of one discipline or another, that we want to make that as easy as possible for them to re-enter the workforce.
But they're saying it's not all that easy, though.
If it's not easy, we look at it again, and we certainly give that commitment. We don't want any impediments for somebody who's certainly, particularly registered practitioners who want to re-enter the workforce and help us vaccinate.
Okay. Look, just a final question, Colm. I know you're probably not going to tell us what your recommendation will be to government, of course.
I haven't heard the question yet.
next week. But I mean, when you look at the cases and you look at the vaccine numbers, and I'm not really a maths woman, but I do like to have a plan. So when you look at where we're at with vaccinations, coupled with rising figures and a rising R number, doesn't really equal any reduction in restrictions, does it?
No, and it is a difficult message, but I would urge people, we are not back to square one. The vaccination is something new. Yes, the figures don't look good. There's a sense of fatigue, huge fatigue among the population looking at these figures rise again. But the vaccinations are giving real protection to the most vulnerable. That was really one of the things worried us much, and that's where we saw so many of the deaths in phase 1. And the second thing, we were so worried about our healthcare system being overrun. As we get into these groups' underlying conditions, hopefully we'll reduce the amount to get sick enough to get hospitalised. So we're eating into the virus defences now. We're beginning to, as this vaccine programme rolls out, we begin to really tackle the worst effects of this virus, and there's certainly every cause for considerable hope.